Good evening. Hi, my name is Ted Darlington, and on behalf of our president, Mikhail LaRoche, our Health and Wellness Committee, and the entire Alpha Phi Alpha Fraternity Incorporated Mu Lambda chapter, we welcome you to our National Diabetes Alert Day conversation on diabetes. Tonight, we'll focus on the body that is, and a subject that is near and dear to us, diabetes. To enlighten us on this subject, we have with us tonight Mr. Daryl Higgins, Executive Director of the DMV region for the American Diabetes Association, and Brother Rodney Robinson. So I will turn this over to Brother Robinson to introduce our speaker. Tonight we'll focus on body and
Thank you, Brother Ted. We appreciate you, and good evening to everyone tuning in to our first in a series of, as Brother Darlington said, health and wellness talks on the body and the mind. I'm privileged today to introduce to all of you Mr. Daryl Higgins, who is with the American Diabetes Association, and I'll be glad to give you a quick introduction to Mr. Higgins. And again, thank you again, Mr. Ted Darlington, Brother Darlington, for the introduction to the series. Daryl Higgins is the Executive Director of the American Diabetes Association's DC, Maryland, Northern Virginia region, a purpose-driven business development leader. As the father of someone living with type 1 diabetes, Daryl is utilizing the breadth of his experience from the for-profit world to advance the ADA's mission. Daryl's been in this role since the beginning of 2022, and his responsibilities include fundraising for different events, forging and stewarding corporate partnerships, and engaging individual donors, developing community partnerships, and with other health communities. He is connecting the community with the American Diabetes Association's wealth of resources. At the end of the day, Daryl is devoted to the ADA's mission to prevent and to cure diabetes and to improve the lives of all people affected by the disease. The ADA's priorities include research, advocacy, community engagement, and the increase of access to quality health care. A native of Washington, D.C., Daryl graduated as my classmate from Brown University with a degree in organizational behavior and management, and played on their football team all 4 years, receiving all Ivy recognition his senior season. He is also a proud alumni of St. John's College High School in Washington, D.C. Daryl lives in the Washington metropolitan area with his wife of 28 years. Their daughter, type 1 diabetes, is currently adulting in Los Angeles, and their son, Georgetown University class of 2021, is now working in New York City for a management consulting firm. Welcome to Daryl Higgins.
Thank you so much, Rodney, for the introduction, and Ted, thank you as well. We appreciate Alpha Phi Alpha Incorporated for this honor and talking about diabetes today.
And Daryl, thank you. We're kind and blessed to have your presence here this evening for a good conversation, presentation, and some data points of how we can help our community live healthier lives. So with that, I'll hand it over to you.
Okay, awesome. Thank you, Rodney. Okay, here we go. Everybody see my screen? Awesome. So Diabetes Alert Day is observed by the ADA and everyone else on the fourth Tuesday of every year. And the objective of Diabetes Alert Day is to encourage people to learn the symptoms of diabetes and understand the risk factors for developing diabetes. And it's really important that early detection is, because the early detection is essential to avoid diabetes related complications, such as heart, kidney, and eye disease, along with other challenges. I'm going to go into some stats real quick just to really get your attention. 1 in 10 Americans has diabetes a day. We're talking about 38 million people, million adults in the United States. And diabetes kills more Americans every year than AIDS and breast cancer combined. So the other point that I like to make, especially to those of you in the business world, is that 25% of healthcare costs are associated with people living with diabetes. And as you can see on the left side of the screen, annual healthcare costs for a person diagnosed with diabetes are 2.6 times higher than for a person that is not living with diabetes. These statistics are just staggering. And then diabetes is a public health crisis. The one thing that we like to point out, especially for the folks on this call, is that second bullet, and the fact that Black and Hispanic adults are more than 70% more likely to be diagnosed with diabetes than are non-Hispanic white people. So what is American diabetes, and what do we do, and why are we important? The mission of the ADA is to prevent and cure diabetes and to improve the lives of everyone affected by diabetes. Again, like Rodney said, I would resonate most with the back half of that mission statement because our daughter lives with type 1 diabetes. So we want to make sure that we are a resource to everyone, but leaning into prevention. We are the credible resource for healthcare providers throughout the world. And in fact, we set the standards of care with this book, actually called Standards of Care for Healthcare Professionals, not just in the United States, but around the world. And we host an annual conference that brings in over 12,000 people every year from around the world to talk about better ways to help not only those people living with diabetes to manage their diabetes better, but more importantly, to prevent diabetes. So prevention, as I mentioned, is a major emphasis for us. We are continuing to research to find a cure. And then, as I mentioned, improve the lives of not just people living with diabetes, but those to prevent them. And then people like myself who are caregivers to their loved ones. So we have a comprehensive approach when it talks about research, as well as advocacy. So we're on Capitol Hill advocating for people in the fight to stop diabetes. That also includes us engaging the community to help others in the community to advocate for themselves. So what is prediabetes and diabetes? Because when we talk about the combination of prediabetes and diabetes, we're talking about 136 million people throughout the United States that are living with one or the other. So prediabetes is when your blood glucose, also known as the sugar, levels are higher than normal, but aren't high enough to be diagnosed with diabetes. We'll talk more about your A1C number, which is important to know so that you have a better idea of what prediabetes levels are versus diabetes levels. Now, this is the staggering stat that I learned when I just started at the ADA about 3 years ago, that approximately 98 million adults are living with prediabetes. On the right-hand side should really scare all of us. 81% of Americans with prediabetes don't know they have it. It's really, really staggering and important to understand what your A1C number is, because if you don't know that you're living with prediabetes, which is an opportunity for you to change your lifestyle so that you don't eventually become diagnosed with diabetes, then you can, again, if you know, then you can change your lifestyle so that you will never be, or decrease the chances of yourself being diagnosed with prediabetes and ultimately dealing with the complications from diabetes. Prediabetes, again, it can lead to type 2 diabetes and many serious conditions. What we recommend and encourage is for people to go on to our site, diabetes.org, and take our risk test. This is a 60-second risk test. It helps to determine whether you're at low risk or at high risk for diabetes. And if you're at high risk, we'll send you an email. Otherwise, we'll leave you alone. So what is diabetes? When you have diabetes, your blood glucose numbers are higher than normal. And what does that mean? An A1C number higher than 6.5. We'll get into that a little bit more. But diabetes means your pancreas is not working properly and not able to satisfy the lifestyle that you're living. So again, type 1, type 2, and also gestational diabetes are the three main diabetes types that we'll talk about today. The symptoms of diabetes are urinating often, feeling very thirsty, not just a little bit thirsty, but thirsty a lot. Like I'm talking about, people talk about drinking eight glasses of water, then you're probably drinking 16 in a day. Feeling very hungry, even though you've been eating. Extreme fatigue, blurry vision, cuts and bruises that are slow to heal. Specific to type 1 is weight loss, extreme weight loss over a matter of time, and you're not even trying to lose weight. Tingling, pain, or numbness in the hands or feet is something that is all this distinct to type 2 diabetes. So again, next steps that you can take are taking our diabetes risk test online, talking to your healthcare provider. If you're at risk, registering for a diabetes prevention program. So if you've been diagnosed with prediabetes, that's what we recommend. And then visiting Diabetes Food Hub, which teaches you and gives you examples of great recipes for different types of foods to cook. Some of your favorite foods, we go by ethnicity. So if you prefer comfort food, soul food, or you prefer Asian foods, there are recipes for all types of different things, just using different ingredients, not as much brown sugar and syrup and all those kind of things, but different seasonings that are healthier and still make things taste good. And then you can also contact 1-800-DIABETES for additional resources. And then we'll talk more about what you can do if you're managing to better manage your diabetes. So again, the three most common types of diabetes are type 1, type 2, and gestational diabetes. Talk a little bit more about type 1. And again, that's what our daughter lives with. And it is when your pancreas, I'll use layman terms. I'm not a clinician, so I'll talk a little bit more layman terms, is when your pancreas no longer produces insulin and you are insulin dependent throughout the day to manage your life. And scientists don't know what causes type 1 diabetes. And one thing is it's not contagious. People talk about it might be contagious. It's also referred to thought that some people are simply consuming too much sugar. We don't necessarily know. And in a lot of cases, it can be hereditary as well. Okay, but we're doing more research to cure type 1 diabetes and diabetes overall. If you have type 2 diabetes, your body still produces a little insulin, but not enough to keep up with your lifestyle. And here are the things that put you at risk for type 2 diabetes: history of high blood glucose, prediabetes, or gestational diabetes, being overweight or obese, physical inactivity. A term I like to use that I learned from someone else is couch potatoism. Genetics, family history, race and ethnicity, age, high blood pressure, cholesterol problems. All of those are risk factors for type 2 diabetes. And then I talked about kind of like the range of what your A1C might be or is determined by, which will determine whether you're not living with diabetes, whether you're living with prediabetes, or you're living with diabetes. If you look on the left, your A1C number. We want your A1C number to be less than 5.7. Okay, so again, if you don't know what your number is, you should. Certainly, when you get your next blood test, find out what your A1C number is. It'll be vitally important to know whether you're living with prediabetes or diabetes or not living with diabetes at all. And so for prediabetes, you'll see that range is between 5.7 and 6.5. If your A1C number is higher than 6.5, then more than likely you'll be living with type 2 diabetes. And then you'll see your fasting plasma. So if you take just one one blood test and they look at your numbers. If they're like 100, that's what they should be, less than 100. But they can spike, so don't take those with a grain of salt. The A1C number is a 3-month average of your blood glucose numbers. Gestational diabetes. This is diabetes that develops during pregnancy. So for all the guys on the line, you don't have to worry about this one. Okay. But you should know that if your blood glucose numbers for women to normal after giving birth, you're still at higher risk for developing type 2 diabetes. Otherwise, if your blood glucose does not return to normal, chances are you will be diagnosed with type 2 diabetes. So treatments that, what are treatments that you can do? Diabetes is treated with meal planning, physical activity, and medications, which may include oral medications, like a lot of people talk about metformin, insulin, and other injectable medications. If you have prediabetes or diabetes, again, we encourage you to believe in yourself. You heard me refer to people living with diabetes. We use that terminology as opposed to being diabetic, because we want people to be empowered. We want people to understand that diabetes does not define you. It is not your identifier. It is something that you live with and you can manage. All right. So sometimes it's hard for you to hold yourself accountable. So I encourage people to find an accountability partner and make sure that that person holds you to the line. Follow a healthy eating plan. We'll talk a little bit about your portions. Oftentimes you need to cut down on your portions. Doesn't mean you can't eat anything. And oftentimes when someone is diagnosed with diabetes, we hear about, the number one question that comes out of their mouth is, what can I eat? You can still eat a lot of the foods you've eaten before. You just have to cut your portions. You can't eat them as frequently. So we like to clarify that. It's not that you can't eat anything any longer. And then engage in physical activity, regular physical activity, as opposed to just doing something, going for a walk once a week. We encourage you to walk every day. Take your medications, lose weight if needed. Set SMART goals. I'm sure we all have heard about SMART goals: specific, measurable, attainable, realistic, time specific. And so you have to work with your primary care physician to set those in place, and certainly work with your caregivers. If you have a caregiver, if you have, whoever's going to be your accountability partner, in addition to you hold yourself accountable. We talked about planning your portions. This is something that I share oftentimes when I go out to health fairs. Plan your portions. This is what a plate should look like, as opposed to the plates that a typical American will eat. Typically, Americans have half of our plates are carbs, are those starchy vegetables like the potatoes on this plate. And maybe, if we're lucky, a quarter of the plate are vegetables, are non-starchy vegetables. But we encourage everyone to half their plate should be non-starchy vegetables. And then a quarter of your plate can be your protein, like chicken, fish, or some other form of meat. And then you'll have your grains and starchy vegetables, and certainly encouraging water as opposed to soda or juice or something of that kind. Staying active, again, really, really important to stay active. Your body's really sensitive to insulin, and it works better if, in fact, you are exercising regularly. And exercise can improve your mood. The different types of activities, we're talking about aerobic exercise, strength training, balance training, flexibility training, and stretching. Again, we're not talking about doing this. I'm imploring all of you, when you're doing exercise, try to make it more regular than once a week. A few times a week will make a huge difference in how you manage your blood glucose numbers, and if you're living with diabetes or pre-diabetes. And when it comes to medications, there are 3 types of medications for diabetes. It's the oral pills, the insulin that you inject into your body, and other injected medications. So bottom line is, we're here to help. Go to diabetes.org or call 1-800-DIABETES at 1-800 342-2383. We'll talk more about, certainly we want to be here for you so that we can help you to prevent or manage your diabetes. We want to encourage your healthy living and let you know again that we are here to advocate for you and help you to advocate for yourself. And we look forward to you participating, getting involved, whether it's a local event that we host for the DMV area. We host an event about to talk a little more about it called DMV Step Out DMV. And we also will hosting in November, which is American Diabetes Month, hosting our State of Diabetes, which will be open to the community this year. And we would like you to help us advocate for people living with diabetes. So certainly you can engage, you can call me, contact me on LinkedIn, or reach out to, to Rodney. And also I'd like you to help take on a leadership role. But before I jump off, I want to encourage as many people as possible to sign up, register for Step Out DMV. This is our walking fundraiser. It will be held in September 20th on the National Mall near the Hirshhorn Museum. There is a QR code on this slide, but sure, you can access this information on our site as well. We want you to come out, help us to build community, increase awareness, and share your story, because stories are extremely powerful. So with that, I thank you for your time, and Rodney, handing it over to you.
Well, thank you, Daryl. A couple of questions for you, Daryl, before as we kind of blend into the broader community who's watching today. If anybody has questions, we encourage you to post your question and your comments on the Facebook live stream, the mulambda.org/live stream, or the LinkedIn live stream. Go ahead and post your questions for Daryl, and we'll have a special guest in a minute. But Daryl, appreciate your presentation and your words. The presentation was smooth. It was a good flow. It seems like it's easy. It seems like, curing diabetes, or at least addressing diabetes issues, is not that complicated, but yet it is. We all have somebody in our family. Everybody on this discussion has someone in our family who's has dealing with type 1 or type 2 diabetes. And once we get to that stage where it's like, oh, we got the sugar, as we say in our community, then it's hard. So again, your presentation made it seem easy, but we know it's really hard. Talk a bit about the psychological transition we have to make in our minds to really make sure that we can be each other's advocates.
Yeah, thank you for that, Rod. And that's a great question, because we don't talk about behavioral health challenges associated with diabetes. It's hard when you've grown up in a culture where food is love. People give you food. And also when you've grown up in a household where people say, you got to clean your plate. I know for me, and I don't live with diabetes, but just when I got to be, in my late 20s, early 30s, I started gaining more weight. My doctor said, you know what, you need to cut down on your portions. You're no longer an athlete as active as you used to be, right? I was getting older, and I realized I got to push away. That was hard for me, right? I can imagine how hard it is for someone living with diabetes, and you really have to. I was doing it, because I definitely, there's a little bit of vanity involved in that as well, because I was gaining weight. But when you have to do it, because it comes down to your health, it's not easy. And that's why I talked about having an accountability partner. If you, again, this is about being vulnerable with yourself and the people that love you. All right. Letting them know this is hard, because living with diabetes is hard. All right. So understand, and people that live with diabetes may not admit it, but there are a lot of people that live with diabetes that are going through depression. Okay. Mm-hmm. And so that's why it's so important. And I talk about the fact that it takes a team approach to take care of someone with diabetes. Doesn't just, not about just talking to your primary care physician. It's not just about going to your endocrinologist, who is a great specialist, right? But it's important to talk to a physical therapist. It's important to talk to your optometrist, right? To make sure your eyes are checked. Make sure you're going to your dentist. Make sure your oral health is good. A podiatrist oftentimes, to make sure you're checking those wounds that might be on your feet that may not be healing properly. It's important. It's a team approach. But again, Rodney, to go to the behavioral health challenges, it is hard for us when we've been growing up a certain way, taught to eat food. Food is love. Okay, and then have to push back and not eat some of the foods that we're accustomed to. Cut down on our portions. All right. And it's just, it's hard. And I want everybody on the line to understand that, that fact that sometimes it takes help, takes you to be vulnerable and talk to, whether it's loved ones or see a professional therapist about, about, just the challenge of that mental health challenge of adjusting to life, exercising more, and your body not operating the way it used to.
Absolutely. Thank you for those words. We have a question from the audience. Manly Collins is asking, how often should one check his or her A1C levels?
Number one, again, because I'm not a clinician, I couldn't tell you specifically, but I would encourage you to make sure, if you, also, if you don't know where your A1C number is and you're not sure whether you might be living with prediabetes, take our risk test. That is a good, helpful, like, guidance on where you might be. But make sure you talk to your primary care physician. How often? Make sure you're going to get your physical once a year. I know for brothers, sometimes you're not going to get your checkup once a year, so it's important to do that. All right, and make sure when you are, your blood check your blood sugar. Have them check your blood sugar. I went in a few years ago and they didn't check my A1C number. Okay, that's why we talk about, we're advocating for you, but you got to advocate for yourself as well.
That's a great point. And I was going to bring that up too, Daryl, that, yeah, I go to my annual physical, I get my blood work done, I look at my report after the fact, I look for my glucose levels. I look for under 100 for glucose, but then you hit me to say, hey, that's not the full picture. The full picture, as you said, is a 3-month A1C look. But all of us on this call, ask your primary care physician to put on the order for your blood work to get the A1C measurement on the blood work, because it was not on mine. I had to proactively ask for that on my annual physical. So that's very key. I'm glad you brought that up. One other question on broad question, we'll go back to some audience questions, is the perspective of the caregiver. I mean, you're a father of a wonderful young daughter with type 1 diabetes, whether we're handling elder care issues, children issues, talk about how your advocates, your family, stay strong and can help be the best advocates they can be when your loved one has type 1 or type 2 diabetes.
It's hard. We always say that if someone in the household lives with diabetes, the whole household lives with diabetes. And that's true for anyone who is caring for a parent or a sibling or a child with diabetes. You sometimes think about changing your habits. And sometimes you do, sometimes you don't. Sometimes you feel bad about, eating a certain food in front of your loved one. But it's also hard to see them go through what they're going through when you think they're capable, they're capable of changing their mind and changing their lifestyle, but they make the decision not to. That's really hard for you as a caregiver. And I know some of you on the line are going through that right now in trying to guide your loved one to do the right thing. And they're reluctant to do it. And it goes back to that behavioral health challenge. It also goes to, Rodney, something you asked about earlier, is also the stigma associated with diabetes. There is still, and we all have to admit it, there's still a stigma associated with diabetes. And I find it in my role trying to find executive leaders around this region to support our cause, that executive leaders don't want to admit that they might be suffering with the challenges or suffering with diabetes, because they think it's going to make them look weak. They think that, leading a corporation or a company, that, if I tell somebody I'm living with diabetes, they're going to think that I'm not eating right, that I'm not exercising properly. And they're going to think, you know what? I don't know whether I want to follow this leader who's not taking care of himself. How can he take care of us if he's not taking care of himself? And so I find that that's a challenge. And I'll ask everybody on the line is, if some of those leaders that are living with diabetes, I need more champions. I need more people step up. And, for me as a leader, I actually appreciate a leader that's vulnerable and willing to admit that they're challenged by something, because it makes them look more human.
Well, Daryl, appreciate that. And it's a good segue, because I've always said, and I know we've talked about, is vulnerability is a strength. And I wanted to bring on the line right now our good Alpha brother, Mark Clark. And I've known Mark for 37 something years from our time in Providence, Rhode Island, and Daryl knew him as well. But one of the impetus for this conversation is certainly it's top of mind for us and our families. But Mark, who I love as my brother, went through some steps that were difficult and challenging for him, and Mark was able to get through it, and he wanted to bring him on the screen to talk about his experience, and you can hear firsthand how he's addressing it from the mental and the physical perspective. So if we're able to bring Mark up, we'll do that in 1 second. While we're waiting for Mark, I know he's going to jump on in a minute here. Daryl, if you don't mind, we talked about the behavioral challenges. We talked about, can you mention your community connection directory and how that might be a good resource for everybody?
So for people that might be looking for resources in their community, there is and I don't think we have the link, but certainly you can go on to diabetes.org and look for community connection. And it is a place where, or you might be under, you can look at diabetes.org and then look for find help. Diabetes.org, find help.
Okay.
And that will connect you with a directory of services that you can use or access for in your community, whether it is for behavioral health specialists, it is for physical therapists, it is for optometrists, whatever type of specialist, or maybe a diabetes prevention program you want to participate in, or it is a diabetes self-management education program you want to participate in. This will direct you to the closest one. You put in your zip code and it'll bring up the closest available options in your area.
Okay, appreciate that.
Rodney, thank you so much for mentioning that, because that is it's a great resource that we have for everyone.
No, absolutely. And again, Mark will come on if it's a bit of technical difficulties. Let me see. Amir Baker, Brother Baker says, I feel like as if there are some leaders that are living with it he's not aware of because they might not divulge it. So I do think the whole thing about getting rid of the stigma associated with it, if there's 98 million people and roughly 88 million people don't even know that they have it, certainly we all will get it, or we all currently have it, and we have to normalize it so we can help each other.
Yeah. The scary stat moving forward, if we don't change the rate of growth of diabetes, is that right now 1 in 3 people live with diabetes or prediabetes. By 2050, which is only 15 years from now, 1 in 2 people will be living with diabetes or prediabetes. And that's a scary thought, is that 1 in 2 people, adults in the United States, will be living with diabetes, and this is preventable.
Absolutely. And once again, if there's questions from the audience, please looking through the questions now to see what we have. Again, a lot of folks are saying I really appreciate the presentation and making it culturally relevant for us, Black and brown folks. And Daryl, just remind us again. You said September 20th. There's
September 20th is our Step Out Walk to Stop Diabetes, again, held on the National Mall. I would implore you, registration is free. We want to get people out. We want to get people out, again, to build community, as the slide says, increase awareness, share your stories. Stories are powerful. You're going to hear Mark's story in a moment, and I guarantee you that all of you will be, inspired, and also it'll grab your attention and motivate you to make a change in your life, or at least be more mindful of how you're engaging your friends, and just managing your lifestyle.
We appreciate that, and we encourage everybody on this call, on this conversation, to put that date down and coming out and support. So Mark is here. Let's bring Mark in, and the 3 of us will stay on the screen. Brother Mark, how are you?
I'm good. How you gentlemen doing?
We are good. We're good. So good to see you, brother.
It's good to see you, Mark.
Good to be seen. What's up, Daryl? How you doing, man?
So you should all know we are the Providence connection. We all were in school together in Providence. But again, I wanted to give 5 minutes or so to Brother Mark Clark to talk about his experience with diabetes, because we all need to be more aware, and Mark had to learn the hard way. But I won't say much more. But Brother Clark will give you the floor if you want to share some words of awareness for us. Thank you.
Yeah, so I'll start with the really positive motivational piece that Daryl was alluding to, which is I'm going to start at the end and then work my way back. And the end is that my A1C is below 6 and my sugar levels are between before or after eating are between 90 and 125. So I can say in the last month that I don't want to say I'm it's like being an addict. I don't want to say that I'm diabetes free or I'm cured of diabetes. I'll say that my diabetes is under control, and it's under control not because I said I'm going to do this on my own, but as Rodney alluded to, I had a serious health scare. So just to give you a little bit of background, from the Bronx, New York, born of Jamaican parentage. And, that sort of gives you a sense of, for those of you that may not know, you kind of feel impervious to any of the ills of the world. You feel almost bulletproof. And I felt that for much of my life, going through Alpha, going through all of the things that I've been through, becoming a principal, just all of the things I've gone through in my life. I've always felt like I can do this no matter what, and nothing will stop me. And in 2023, I had reconnected with the love of my life. I was, getting, doing a lot of great things in my life. And I was diagnosed with diabetes, but I did not own it at all, to the point where my lady Dawn would say things like, well, you've got to be careful with your diabetes. And I'd be like, I'm not diabetic. I don't know what you're talking about. Right. And that was me denying the reality that I was diabetic. And what ended up happening was I got a small sore on the bottom of my foot. Not even a sore, like a just a small ding. And I ended up going to the doctor, and I had a stress fracture. And the doctor was like, listen, stress fractures happen all the time. You can stub your toe, you don't even realize it, and you keep on moving. And because there's so many bones in the foot, you don't realize you have this stress fracture. He was like, but you know what? We're going to put this boot on you. You'll be fine. Thought I would be fine. And I really believed, again, that this diabetes thing wasn't even bothering me. As months went by, the foot wasn't getting worse, but it just wasn't feeling right. And I just kept saying, oh, it's a stress fracture. Oh, it's this. And then I ended up getting a sore on the foot. And the sore started getting slightly bigger, slightly bigger, slightly bigger. And again, still in denial. Didn't want to admit there was a problem. And finally, I started seeing a podiatrist. And he was like, look, the problem is that because he's like, you're diabetic, huh? And I, again, still wanted to not admit it. Finally admitted it. And I'm like, yeah, well, I've been diagnosed, but I think it's under control. He was like, well, whether it's under control or not, the diabetes is slowing down your healing process. So that's why this wound is not healing. So he was like, I'm going to put it under treatment, all of this stuff. About a month and a half later, I caught an infection and didn't know I had this infection. And to keep it real with everybody on here, your boy almost wasn't here. And as I've told Rodney and others, you were almost planning to come to my funeral at that point. when I saw the doctors later on in the hospital that I did not recognize, they said to me, the night you came to the emergency room, we almost lost you. This was 2 months ago. So I tell this story because I want to say that I now know that I have to be honest with myself and with my loved ones that, yeah, you've got diabetes and you've got to keep it in check. And also what that means is I've got to think about everything I put in my body. So let me just tell you what happened to me from that little itty bitty sore and me not admitting I had diabetes. I ended up in the hospital with sepsis. I had MRSA because the infection had gotten into my bloodstream. It got into the bones of my foot, and I had the top of my foot amputated. Because this infection, now mind you, by this point, funny enough, I had gotten my diabetes under control because I was taking metformin twice a day. If I remember correctly, I was taking 500 milligrams of metformin twice a day. So at the point when I got the infection, my diabetes was actually under control, but the problem was the diabetes had already slowed down the healing process, so that infection was able to get into my foot and cause the situation that I was in. So I'll just end by saying this. It is possible to get diabetes under control and live without being under meds. I left the hospital. I'm no longer on metformin. I'm no longer on any insulin. I just have to maintain a very specific diet and be very dogged about that diet. I have to exercise regularly, which I'm doing. My son will tell you. He just saw me working out yesterday. And I have to get enough rest each night. And those things may sound simple, and they can be, but you have to make that commitment. And I will, one last thing, God and my loved ones have me here right now. My family, my like I mentioned, the love of my life, my 2 children, and my friends and family and my fraternity are the reason why I'm standing here. And God put all of those things in my life. And so I want to just say to all of you, it is possible to get over this and to get through this and not to end up like me with a half a foot, but you have to put in the work now before it gets to that point.
Thank you. Thank you. Thank you, Brother Mark.
Thank you, Mark.
Yeah. Can you talk for 1 second, Mark, about your advocates? You mentioned your son, Jabari. Talk about your network, your accountability partners. Who's helping you through this right now?
Yeah, so it's my wife who's on me. On me about my eating and making sure I'm working out. And, you know, some may call it nagging, whatever you want to call it, but I know she's doing it out of the love that she has for me. And as she says, I want to be 90 something years old with you. And I don't want you to be gone. It's absolutely my 2 children. My son is here with me right now. My daughter was here with me last week. They're both professional working professionals that have their own lives, but they've made a commitment to be here for me when I need them. So they changed my wound on my foot, which is now healing well, and hopefully I'll be having a prosthetic soon. And as the doctors and everyone have said, I'll be walking around regular, and unless I tell someone, they won't know. And then I have brothers like yourself, Rodney, and others who just call to check in, send me a text, hey, how you feeling? How you doing? And those things are also motivating to me as well. So what I've realized is that I was imprisoning myself by not telling what was going on. When I should have been more open, I would have gotten that support before all of this happened. And so the reality is when you do say, I've got diabetes and I've got to do better, you actually are freeing yourself so that your family, your friends, your loved ones can be there for you, and not hiding it and trying to, act like it's not there when it is.
Well, sincerely, we thank you for taking this step to tell your story, Brother Clark. And I'm sure you're inspiring a lot of people and you're making more people aware. So we do appreciate you and you sharing your story. And with that, Daryl, any final words on your part?
I just want to say thank you to everyone that joined the line. Rodney, Ted, man, Mark, that was an incredible, powerful story. And thank you for being vulnerable with us now. And certainly, I wish you well. The three things I want to say to you, Mark, is I appreciate you not only being vulnerable, but also talking about the fact that you can thrive living with diabetes, because people don't recognize after you've been diagnosed, they don't feel as though you can still thrive. And the fact that you are managing it. And then the fact that you finally did own it. Because that's a huge hurdle for people to overcome, is the actual owning their diabetes. And then last thing I'll say, Rodney, is again, thank you to you, thank you to Ted, thank you to Alpha Phi Alpha Incorporated for this honor of presenting to this audience.
And Daryl, please get my contact information from Rodney if there's any groups or individuals or anyone that you feel my story will be helpful to. Please don't hesitate to, connect with me, and I'll be available and in any capacity that you think is best.
We'll definitely connect with you. No doubt, Mark. Yeah. Thanks a lot.
All right.
Thank you. Thank you again, Brother Clark. And Mr. Daryl Higgins, my good friend from years and years, we thank you for giving the context, giving the right foundation, and giving us the tools we need and that we can use to better ourselves, better our families, and better our communities. And with that, everyone, thank you for spending time with us tonight. Our new Lambda talk on health and wellness and the body and the mind. It's very important for us to continue to be servants of all so that we can continue to help our community, obviously serve our community and enlighten our community so we can all get through things together. Let's all be each other's advocates. Let's all help each other out, and let's all keep spreading the word about this critical disease that affects so many in our community. So thank you and have a great night.